HRX for the opportunity for me to present this work. I can't think of a better forum and a better audience to share our innovative approach with and these insights. My name is Nikhil Alawalia. I'm an EP Fellow and PhD candidate at Bart's Heart Centre in London, UK, and our presentation today is entitled Integrated Activity and Rhythm Data for the Personalised AF Management Following Catheter Ablation, a wearables approach. Now, wearables can be used to reproduce traditional endpoints that we use in AF management. They have the facility to record ECGs and even track symptom scores. But I want to present to you our pilot work integrating these features and also talk to you about a novel one as well. So we can categorize the spectrum of endpoints that we use to evaluate the success of AF along a scale like this. On one end, we have rhythm-based metrics, such as continuously monitored heart rhythm using CIEDs. And these are objective, continuous, and quantitative, all desirable features, especially in the setting of clinical trials. On the other side, we have patient-reported outcomes, which also have benefits, namely they're accessible, and importantly, they're patient-centered. Wearable devices like the Apple Watch can be leveraged to simultaneously track rhythm and symptom-based outcomes. As well as tracking disease, wearables are synonymous with health. And anyone who's seen these coloured rings knows that they can be used to track activity and exercise over time as well. So as part of this project, we developed a script that was able to index the daily step count around the catheter ablation event for a visual and statistical comparison of activity levels before versus after the blanking period. So before the ablation and after the blanking period. We were also able to overlay the ECG labels from the derived ECGs onto the daily activity counts. And then we were able to categorize these according to rhythm, with red used to represent days when atrial fibrillation occurred, and green used to represent days with only sinus rhythm. Again, we indexed this around the AF ablation event, shown here in purple, and we were able to derive the traditional outcome measures such as freedom from AF, time to first AF recurrence, but also novel parameters due to this integrated approach, such as the change in activity or quantify the impact of any recurrence based on the activity levels and exercise capacity during AF versus sinus rhythm. Therefore, as part of this work, we undertook work to assess the feasibility and evaluate the clinical utility of this paired ECG and activity approach as an AF ablation outcome measure. Patients undergoing first-time catheter ablation with prerequisite ownership of a Series 4 or higher Apple Watch device were enrolled into this study. They were alternatively provided with an Apple Watch as part of enrollment in a larger Apple Watch-based study entitled AFFU-AW, which is an RCT being conducted at our institution to evaluate Apple Watch-led follow-up after catheter ablation. Now, 23 patients were enrolled, and the median daily step count in the 90 days prior to AF ablation was 6,771 steps per day. With regards to traditional outcome, AF recurrence was seen in 13 patients at 1 year, with a median time to recurrence of 112 days after the 90-day blanking period. Of these, 12 patients experienced a significant increase in their activity levels after the blanking period compared to before the AF ablation. This is represented as the green paired bars in the bar chart here, which shows the median step count before versus afterwards. Now, the median change in daily step count in the between the 90-day periods was 1,111 steps per day greater after the procedure, corresponding to a median increase of 16%. 10 patients did not demonstrate any significant improvement in their daily activity, and this was mediated in 7 patients by a significantly lower daily step count seen on the days when AF events occurred compared to the activity levels on days without AF. Now, this pilot study has demonstrated the feasibility of the Apple Watch derived activity as an objective quantitative outcome measure after catheter ablation. When integrated with rhythm data, It can be used to show rhythm-related differences in activity as one possible surrogate for quality of life and may support further management decisions. Now, whether traditional outcome measures and these novel outcome measures provided by the Apple Watch can significantly improve long-term ablation outcomes and the quality of life is the subject of an ongoing study, the AFFU-AW study that I mentioned earlier, that is comparing Apple Watch-led care to standard of care, and it's due to complete enrollment by December with the results expected next year. In the interim, wearable-derived longitudinal data is becoming increasingly available to our patients, and we need to develop the appropriate infrastructure and software to analyze and interpret the inevitable influx of multidimensional data for clinical use and to support the patient to inform the management of their own condition. That's why I'm glad to have been able to present this work and have the opportunity to discuss it with you here at HRX. And I look forward to to collaborative discussion and plans to explore this further as a community. Thank you.